Dear children, now we came to the last lesson of this competency level, where we want to cover up the diseases associated with respiratory system. In your textbook, it is explained in the 156 to 157 pages. At the end of this video or the lesson, you should be able to present information on diseases and disorders associated with respiratory system and their prevention. So this is the first disease, very common. So it is called as common cold. It is the most common respiratory disease in the world. There are so many causative agents, different types of viruses, and mainly viruses. Here given you only two types of viruses, rhinovirus and influenza virus. There are so many viruses cause common cold. Only two is given to you. This is a very common among 3 to 8 age groups and less vulnerability with age. That means when you grow older, getting common cold is less. But in the very small ages, very quickly these small children get this common cold. There are more than 150 types of viruses acted as causative agents for common cold. I have mentioned it already. Because of having many different types of these viruses, common cold can be occurred frequently, unlike chickenpox and measles-like viral diseases. Because when you get once, if you get chickenpox once, we know that immunity is developed and there is a less chance to getting the chickenpox next. But in the common cold case, it is not that, because there are more than 150 types of viruses are there. So such kind of development of immunity cannot be expected. So what you should do to prevent this common disease, you should not try not to expose to dust, dew or rain. Without having contact with the people who are suffering from common cold is another type of prevention. And the best thing is, by consuming healthy diet, you can improve your immunity. Now the second one is the pneumonia. This pneumonia can get anybody at any time. The lungs are infected and the fluid may accumulate in the lung. As a result of that, what will happen? Inflammation of the lung, edema. Causative agent may be bacteria or virus types. Symptoms are the cough, high headache, high sweating, and yellowish or greenish phlegm, fever, loss of appetite, difficulty in breathing, etc. Now, pneumonia actually in some cases. Now, just think about this corona pandemic situation. Pneumonia situation is if you infected by coronavirus, pneumonia also the patient may be subjected to pneumonia in the later stages. So it's really common, and there are so many situations or very that is why I said anyone can get this disease at any time. The third one is the asthma. Breathing difficulty due to the inflammation of bronchioles. Here, bronchioles are these. Inflammation. So what will happen? This passage is blocking. This is mainly happen due to the dust, pollen, sawdust, fur and smoking. It's a kind of allergy situation. Many of the times the patients show very difficulty in breathing, sometimes may cause death. Mucus is accumulated in the alveoli and make a significant noise when they breathe. It's a kind of, in Sinhala we can say, rang room sadhyak wage deyak enawa. There is no exact cause for this disease, so that we can say it as a multiple cause disease, because asthma is mainly happens due to allergy situations. Bronchitis or bronchial inflammation. This disease, now here this is the normal bronchial. This is the bronchitis situation. Now can you see the situation? What will happen? The air passage is, now the lumen is very small. The disease occurred in the bronchioles in the lungs due to the action of virus or bacteria. May be chronic or may be acute. What is the meaning of chronic and acute? Acute means conditions are severe and sudden in onset. Acute, because conditions are severe and sudden. Chronic means a long developing syndrome situation. So both the things can be happen. So symptoms are the increase the production of mucus from the bronchus, cough, phlegm, greenish yellow viscous sputum. When the disease become more severe, difficulty in breathing resulted secondary infection as pneumonia. Fifth one is the tuberculosis or TB. Causative agent is bacteria. You have to remember the causative agents for all these respiratory diseases. Now it is bacteria, Mycobacterium tuberculosis, identified by Robert Koch, doctor, in 1882. What will happen in the tuberculosis situation? This bacteria damage the tissues. So tissues of the lung by multiplying inside the lung. It is common in animals also, not only human, common in animals such as dogs, cats, rabbits, horses, donkeys, goats, etc. This bacteria weaken the immunity of the body. This can be spread from person to person by contacting the phlegm or with sputum of the diseased person. But remember, by taking medicines in a correct manner, we can cure this disease. The symptoms are the unexplained weight loss. There is no reason for the weight loss. Prolonged mild fever. That means mild fever for longer period of time. And night sweating. Loss of appetite. Release of blood during coughing. That is the latter stage symptom. And tiredness. Sixth one is emphysema. A condition in which the air sacs of the lungs are damaged and enlarged, causing breathlessness. In the dictionary, the dictionary given this definition. Smoking can lead to serious lung diseases such as emphysema. During this condition, reduce the surface area of the respiratory surface, because now you can understand this is occur in the air sacs, that means alveoli. We learned about the inflammation in bronchus and bronchioles. Now the air sacs. During this condition, it's a very severe situation, reduce the surface area of the respiratory surface. The reason for this situation is the exposure to polluted air. Sometimes, many of the time in Sri Lanka, in rural areas, we do cooking in traditional firewood kitchens. So, if the people exposed to this smoke for a long period of time, that can be happen. And smoking, cigarette smoking, inhalation of poisonous gas causes emphysema. Here this is the alveoli with emphysema. Now you can understand the efficiency, how lung do its work in an efficient manner. Another one, silicosis. This name gives you the idea. Workers work in quarries, Gulf Korean quarries, coal mines, glass industry exposed to silicon contaminating compounds. The lung tissues get degraded gradually. Now you can see this, the deposition of this silica, simple silicosis. This is simple silicosis. So what will happen actually? The activity is the respiration or this breathing. It cannot be done in an efficient way. Asbestosis. This disorder occurs due to the inhalation of air contaminating asbestos particles and fibers. This is very common in the workers who work in this asbestos producing industries, workshops. Tissues of respiratory tract get destroyed due to accumulation of these particles. And ninth one, this should be ninth one, diseases associated with smoking mainly cause lung cancer, bronchitis and emphysema. So all these two actually discussed. So lung cancer you can understand. Now why this is happening, why this happens, we have discussed that one. In cigarettes, that is produce tobacco smoke, it has a very complex harmful chemical substances like nicotine, carbon monoxide, tar and irritants substances. Nicotine is the most harmful compound found in this tobacco smoke. What will happen this due to nicotine? It is a kind of stimulant. Needed a very small amount, cause body to release hormone adrenaline. This adrenaline stimulate increasing the heart rate and blood pressure, cause blood vessels to contract, makes blood clots more easily, thus increasing the risk of developing coronary heart diseases. If we look at this nicotine resulted, or this how this associates the respiratory disease is due to this more chronic bronchitis or emphysema. So if you look at the carbon monoxide in the tobacco smoke, carbon monoxide is a colorless, odorless, poisonous gas. Cause a reduction of oxygen supply to heart and damage lining of blood vessels and increase the fatty deposition on the walls of blood vessels. Again cause chronic bronchitis and emphysema. Tar. It is a dark brown sticky substance containing cancer-causing chemicals. Tar in the cigarette smoke causes lung cancer, thoracic cancer and mouth cancer. So due to this tar. And other irritant substances also there. What are these irritant substances? Carbon particles, oxide of nitrogen, etc. These also cause, because these narrowing the air passage. Then what will happen? Chronic bronchitis and emphysema are resulted. Now we came to the end of this fourth lesson, the diseases associated with respiratory system. So what you should be able to give the learning outcome is you should be able to give the information on disease and disorders and the prevention. How can you prevent? By inhaling pure or less pollutant air. That is the for we can prevent all these respiratory diseases by inhaling clean air, not exposing to such polluted air. So finally, I would like to give a special thank to Mr. G.T. Subasinghe, retired Project Officer Science in NIE Sri Lanka, and thank you all of you for watching this video. Hope you have gained some kind of knowledge about the diseases related to the respiratory system. Thank you.